Welcome back to part 2 on me talking about this article in the most recent JAVMA publication. It's called Ditching the Blame Game, Effectively Responding to Medical Errors. And I was pleasantly surprised to see that so many people were interested in this subject because I kind of thought I was the only one, but here we are. A lot of people are very interested in this and want to learn more. So I would like to make a series about this because I do think that it is vitally important. And I think one of the most important things to start with is kind of getting everybody on the same page with talking about what constitutes an error. And this article actually did a really good job of outlining the different medical error types and examples. So I'm just going to read from this issue. So the first one is anything with drugs. So anything with pharmaceutical administration, ordering, anything like that. Iatrogenic, which means a complication from a procedure or a treatment other than a drug. So if there was a surgical complication or the dog got hurt while being taken out to go to the bathroom, what have you. Iatrogenic just means at the hospital. System, which means anything that was delayed, mistreatments, or protocol issues. That's really an issue with the system. We've also had times where even like our software had something input incorrectly. So there's a lot of different things that could be. Communication. So misidentified patient, confusion over orders, or failure to share information. Obviously, this is a huge one in any field. Lab, any lost specimens, mislabeled samples, results not reported, delays, or improper studies. That happened a lot at our hospital for sure. Oversight. So this could be judgment issues, misdiagnoses, misinterpretation of data, or deviations from standard of care. As a doctor, it's very important to make sure that we are practicing within the standard of care, but also important for RVTs and vet assistants. Staff, so insufficient staff numbers, lack of access to needed staff, or incident during staff training. And then lastly, equipment, so inaccessibility, wrong equipment, failures, or supply problems. Basically, that's kind of talking about like the things that can cause different sort of errors and the things we need to think about when trying to correct these things and put systems in place to make a safer hospital. Stay tuned for the next part of the series.